I'm Dr. Gardner, and this is my super quick and easy guide to intervertebral disc disease in dogs. So first of all, what is it? It's when the disc between the vertebrae is damaged in some way. Usually it's a result of inflammation. It can be from trauma or it can be from chronic disease. Dachshunds, corgis, Frenchies, those are all more prone to it. Common symptoms that you'll see are reluctance to move their neck side to side or up and down. Sometimes they won't even want to reach for their food bowl. Sometimes they'll cry out randomly, or when you go to pick them up, they're particularly painful. They'll be painful along their back. Some dogs get so bad that they'll actually drag their legs around. And then also sometimes you'll see limping. Signs can be constant or they can be intermittent, but all of those things are something to be concerned about and taken seriously. Diagnosis can be made on physical exam depending on what the symptoms are. And then also x-rays can occasionally be helpful because it will show a narrowing of the disc space. And you can't see the discs themselves, but if you see that the bones are closer together, that can be highly suggestive if it goes along well with the clinical signs. Definitive diagnosis is done on an MRI. That is a test that is done under general anesthesia. So always take that into consideration with your dog's other health risks and if they're capable of undergoing anesthesia. Also be aware that the cost, I live in the northeast portion of the United States, so cost around here is between $5,000 to $7,000 for that test. That includes usually the stay over the night before, general anesthesia for it. They usually will do chest x-rays to make sure that your dog is healthy enough to undergo that process. But it is just a diagnostic test, so that's important to take into consideration. So treatment, so surgery is definitely an option, and an MRI must be done to determine whether or not that can happen. And then surgery will add an additional $5,000 to $7,000 on top of the MRI, so keep that in mind with cost. Other options that are more traditionally used are steroids to reduce inflammation, so taking pressure off that disc, similarly to how we actually treat humans with that disease. Also pain medication and restricted exercise. So other things that you can also think about are laser therapy, acupuncture, and herbal support. So all of those can be really helpful. And I think that physical therapy is an integral part of getting these dogs back to normal. So if you've had a dog with intervertebral disc disease, I would love to hear your experience and what you chose to do and how the outcome was. If you have any questions or comments, I would love to hear from you. I hope you will like and subscribe, and I will see you next time.